Welcome and thank you for selecting this course for your professional development. It's my pleasure to lead you through this course crafted by ecert Training. Our commitment is to provide high quality training that not only builds your knowledge, but also arms you with essential skills for professional excellence. This course is divided into multiple units, each aimed at deepening your understanding of the topic and enhancing your ability to demonstrate competence and compliance in your field. Whether your goal is to upgrade your skills or fulfill specific training and compliance needs, we've designed this course to maximize your learning. So make sure you're comfortable, have your notepad ready to take any notes, and feel free to pause and rewatch any section as you need. Welcome to Unit 1 of our basic first aid training course, focusing on first aid in a care setting. This session is designed to guide you through the essential aspects of workplace first aid, aligned with health and safety legislation in the UK. Our goal is to equip you with the knowledge and skills to effectively respond to emergencies and maintain a safe working environment. Health and safety legislation mandates both employers and employees to identify and mitigate risks within your workplace. It's imperative to establish adequate control measures to minimize accidents and health issues affecting anyone on the premises. Yet, even with the best preventive measures, emergencies can still occur. Under the Health and Safety Regulations of 1981, it's your employer's responsibility to conduct risk assessments and provide suitable first aid arrangements. This includes ensuring the availability of first aid kits, trained personnel, and necessary facilities to offer immediate help during medical emergencies or injuries. To align with these regulations, employers can access comprehensive guidance from the Health and Safety Executive's website. This resource aids in fulfilling legal duties by outlining the requirements for first aid equipment, personnel, and facilities. Speaking of first aid kits, did you know there's no one-size-fits-all content list? The contents of your workplace first aid kit should be tailored to the specific needs and potential risks present. However, British Standards BS 85991-2019 offers a guideline for a medium-sized workplace first aid kit, including items like waterproof plasters, sterile dressings, and resuscitation face shields, among others. Your workplace should appoint a responsible individual to maintain the first aid kits, ensuring items are up to date, undamaged, and replenished as needed. Depending on the size and layout of your workplace, multiple kits may be necessary to ensure they are accessible in an emergency. Remember, the location of first aid kits should be clearly marked and known to all employees. In instances where the kits aren't in open view, appropriate signage should guide you to their location. Welcome to the next crucial segment of our first aid training program, focusing on the specific training you might need and your role in maintaining a safe working environment. It's the duty of your employer to determine the level of first aid training required, ensuring availability of trained personnel at all times, including periods of employee holiday and on all shifts. Every member of the care staff, including you, is expected to possess basic first aid knowledge. This foundation enables you to understand your responsibilities, familiarize yourself with the employer's first aid policies, and effectively summon emergency services when needed. Consider who is the appointed person in your workplace responsible for first aid provisions. It's crucial to identify this person following this training if you haven't already. Upon providing first aid, the responsibility to ensure the incident is recorded and reported falls to you, aligning with your employer's policies. Typically, the injured person is best suited to report the incident. However, if they're unable, a witness or the first aider should take on this task. Remember to comply with GDPR. Accident reports must be securely filed and accessible only to authorized individuals. These reports are crucial for risk assessments, managerial reviews, and inspections. Under the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations, or RIDDOR, certain work-related injuries, diseases and dangerous occurrences must be officially reported. This includes work-related fatalities, major injuries and specific dangerous occurrences, among others. Reporting can mostly be done online, with immediate reports required for fatal and major injuries, and within 15 days for over 7-day injuries. Remember, it's usually the employer's duty to report, but in some cases, a designated responsible person might do so. COSH regulations demand that employers assess risks from hazardous substances and implement measures to mitigate them. This includes ensuring proper storage, handling, and employee training regarding hazardous substances. Effective control measures, from ventilation systems to personal protective equipment, are essential. Employers must also establish emergency procedures for accidental exposures and maintain records of risk assessments and health surveillance. In the context of first aid, using disposable gloves is critical to prevent cross-infection. After handling an incident, gloves and any other contaminated materials must be disposed of as clinical waste, with all bodily fluids cleaned up safely. Welcome to Unit 2 of our basic first aid training, focusing on incident management. This unit is pivotal in preparing you to effectively manage emergencies, ensuring safety, limiting further harm, and promoting recovery. When confronted with an accident or a medical emergency, your ability to take control and prioritize actions can be life-saving. Regardless of the scenario, you have 3 fundamental aims: prevent harm, limit the effects of the casualty's condition, and promote recovery. Your first responsibility is always to yourself. Assess the scene for hazards such as sharp objects, electricity, or fast-flowing water. If it's not safe, do not proceed. Call for emergency assistance immediately if the scene cannot be made safe. Upon ensuring your own safety, your next step is to assess the casualty. Prioritize conditions that may affect their oxygen supply, such as lack of breathing, heavy bleeding, or shock. Recognizing these signs and symptoms is crucial for immediate action. For a conscious casualty, employ the sample assessment to gather vital information. This includes symptoms, allergies, medication, past medical history, last meal, and event history. Each aspect offers clues to effectively plan your actions. Encountering an unconscious casualty requires the DRAB approach: danger, response, airway, and breathing. This model guides you in ensuring the scene is safe, checking responsiveness, and securing the casualty's airway and breathing. If the casualty is breathing, place them in the recovery position, dial for emergency services, and monitor their condition closely. Prioritize threats to their oxygen supply and be vigilant for any signs of improvement or deterioration. Managing an incident effectively requires calmness, quick assessment, and decisive action. By following the principles outlined in this unit, you will enhance your capability to prevent harm, limit further injury, and promote recovery in emergency situations. Now we delve deeper into vital first aid techniques, starting with understanding agonal breathing. This unusual breathing pattern, characterized by short, irregular gasps, can occur after cardiac arrest. It's crucial to recognize that this is not normal breathing, but a sign of serious distress. Treat individuals displaying agonal breathing as if they are not breathing at all. Let's move on to a critical skill every first aider should master: opening an airway. This procedure is essential for maintaining an open airway in unconscious individuals. For casualties with no suspected neck or spine injuries, the head tilt, chin lift technique is your go-to method. Place 2 fingers on the bony part of the casualty's chin and 1 hand on their forehead. Gently tilt their head back while lifting the chin to open the airway. In cases where a neck, head, or spine injury is suspected, opt for the jaw thrust. Kneel above the casualty's head, placing your fingers at the back of their jaw, and gently thrust the jaw forward, taking care not to move the head or neck. An unconscious person who is breathing should be placed in the recovery position. This ensures their airway remains open and significantly reduces the risk of choking on vomit or other fluids. Start by positioning the casualty's nearest arm in a stop sign posture, then cross their other arm over their chest, placing their hand on their cheek to stabilize the head. Bend the leg furthest from you and gently roll the casualty towards you into the recovery position. Once in the recovery position, it's imperative to keep monitoring the casualty's breathing and airway. If they need to remain in this position for an extended period, remember to switch sides after 30 minutes, unless it aggravates their injuries. Mastering these first aid techniques is crucial for providing effective emergency care. Remember, your actions can make a significant difference in the outcome for someone in distress. Practice these skills, stay prepared, and you could save a life. Welcome to Unit 3, focusing on managing casualties who are not breathing. This is a critical juncture in first aid where immediate action can mean the difference between life and death. Upon identifying a casualty who isn't breathing, your prompt actions are vital. Ensuring the scene is safe, checking for responsiveness, and opening the airway are your initial steps. If the casualty is not breathing, immediately call 999 for emergency services. Cardiopulmonary resuscitation, or CPR, is essential in circulating oxygen within the casualty's body until professional help arrives. It's important to note that CPR should only be attempted by those who have received proper training. To perform chest compressions, place the heel of one hand on the center of the chest and your other hand on top. Press down firmly, approximately 4 to 5 centimeters, maintaining a rhythm of 100 to 120 compressions per minute. Rescue breaths can further aid oxygenation. After ensuring the airway is open, pinch the nose shut and blow steadily into the mouth for about 1 second until the chest rises. However, if breaths are not effective, continue with chest compressions without delay. In cases of drowning, begin with 5 initial rescue breaths before continuing with the standard CPR cycle. This is critical to address the oxygen deficiency caused by the inhaled water. The golden hour is a critical window for a non-breathing casualty's survival, encompassing early access to emergency services, early CPR, early defibrillation, and advanced cardiac life support. As first aid providers, your role in the first 2 stages is crucial. Remember, your actions within the first minutes of discovering a non-breathing casualty can significantly impact their survival chances. When faced with a life-threatening situation where a casualty is not breathing, knowing when and how to call emergency services is crucial. Your actions during these moments can significantly influence the outcome. If a bystander is present, immediately delegate the task of calling emergency services to them. This allows you to concentrate on providing immediate first aid. If you're alone, your next steps depend on the casualty's age and condition. For children, adults showing sign of force or trauma, choking or drowning, initiate CPR immediately. After 1 minute of CPR, make the call to emergency services. In contrast, if an adult casualty shows no signs of external force, trauma, choking, or drowning, assume the issue may be heart-related. In such cases, you must phone emergency services the moment you realize they are not breathing. When calling emergency services, stay calm and clear. Provide them with your location, the casualty's condition, and any other relevant information they might need to assist you effectively. Your ability to assess the situation accurately and act swiftly by calling emergency services can make a significant difference. Remember, in emergencies, every second counts. Your preparedness and response can help save a life. Welcome to Unit 4, where we tackle the urgent and critical situation of choking, a scenario where swift, confident action can save lives. Choking occurs when an object, often food, obstructs the airway, making breathing difficult or impossible. Identifying the severity of the obstruction is crucial. Mild obstructions allow some air passage, indicated by coughing or wheezing, while severe obstructions block airflow entirely, a dire emergency requiring immediate action. For a mild obstruction, your role is to encourage the casualty to cough, assisting the natural response to clear the obstruction. Stay calm and reassure them, avoiding any physical intervention that could worsen the situation. Severe obstruction is a life-threatening condition. After ensuring safety, check the casualty's mouth for visible obstructions. If none are found, apply up to 5 sharp back blows between the shoulder blades, checking the mouth after each blow. If back blows fail, perform abdominal thrusts. Stand behind the casualty, use one hand to form a fist above the navel, cover with the other hand, and pull inward and upward sharply. Repeat this up to 5 times, checking the mouth afterwards. Continue alternating between back blows and abdominal thrusts. If the casualty becomes unconscious, follow the DRAB steps and commence CPR if necessary, ensuring you've checked the mouth for obstructions. After an incident involving abdominal thrusts, it's crucial the casualty receives medical attention to rule out potential internal injuries. Your quick and appropriate response to choking can make a monumental difference. Welcome to Unit 5, where we address how to effectively manage bleeding and burns, common yet potentially severe emergencies. Let's start with the fundamental step of always wearing disposable gloves to prevent cross-infection. Minor wounds, though not life-threatening, can lead to infections if not properly managed. Gently cleaning the wound and applying a sterile dressing are your first steps toward promoting recovery. For heavy bleeding, the situation is more critical. Bleeding not only causes loss of blood, but also diminishes the body's ability to carry oxygen. Immediate action is required, possibly including calling 999 for emergency assistance. The treatment for heavy bleeding involves 4 key actions: pressure, exposure, elevation, and position. Remember, these can be performed in any order based on the situation's demands. Nosebleeds, though common, can be managed by leaning forward and pinching the nostrils. For more severe situations, like penetrating chest wounds, immediate professional medical help is crucial due to the risk of complications such as collapsed lungs. When faced with embedded objects, remember not to remove them. Instead, control bleeding around the object and prepare the casualty for professional medical treatment. Treating burns and scalds promptly can prevent infection and minimize scarring. Cool the affected area under running water for 10 to 15 minutes, then cover it appropriately to protect against infection. Whether dealing with bleeding, burns, or other injuries, your immediate and correct actions can prevent further harm and support the casualty's recovery. Always err on the side of caution and seek professional medical advice when needed. Welcome to Unit 6, focusing on recognizing and treating shock, a critical condition that can be life-threatening without prompt and appropriate care. Shock can result from heart issues or significant fluid loss due to various causes, such as bleeding or burns. Identifying shock early can be crucial. Look for rapid, weak pulses, pale, cold, clammy skin, and symptoms like weakness, nausea, or dizziness. Untreated, shock can lead to more severe outcomes, including loss of consciousness. Treating shock involves several key steps. First, ensure the scene is safe. If the casualty is responsive, gather information using the sample model. Calm and reassure them, lie them down, and raise their legs unless they're impacted by other injuries. Keeping the casualty warm and continuously monitoring their condition are also vital. Remember, quick and correct actions can significantly improve their recovery and survival. Fainting or sudden loss of consciousness can be related to various factors, including low blood pressure or dehydration. Lying the person down and raising their legs helps encourage blood flow to the brain. Ensure the individual stays down until fully recovered, helping them to slowly rise to prevent another fainting episode. Recognizing the cause and symptoms of fainting is key to preventing further incidents. Understanding how to recognize and treat shock, as well as manage fainting episodes, is crucial in first aid. Your knowledge and actions can significantly aid in these emergency situations, potentially saving lives. Welcome to Unit 7, where we explore other common medical emergencies. Knowing how to recognize and respond to these situations can be crucial in providing help and potentially saving lives. Let's look at a few of these, what they mean to the individual, and how you can make a difference. Seizures can be alarming. Protect the individual by clearing the area of dangerous objects. Time the seizure, and once it ends, place the person in the recovery position. Always call an ambulance if the seizure is unusual or if it's their first. Hypoglycemia or low blood sugar requires quick action to provide sugar to the individual if they're conscious. For severe cases where consciousness is diminished, maintain their airway and call for emergency services. Emergency asthma care involves calming the casualty and assisting with their reliever inhaler. If there's no improvement, immediate medical help is necessary. Heart attacks demand immediate attention. Make the person comfortable, encourage them to chew an aspirin, and call for emergency medical help. Strokes are medical emergencies where every second counts. Use the FAST test to recognize the signs and call 999 immediately. If conscious, help them to a raised position. If unconscious, check their breathing and prepare to perform CPR if necessary. Understanding how to respond to these common medical emergencies is vital. Your prompt action can make a significant difference in the outcomes for those affected. Stay informed, stay prepared, and your readiness can save lives. As we conclude our journey through the basic first aid training course, we reflect on the vital skills and knowledge we've shared. From managing incidents in your workplace to addressing common medical emergencies, the importance of basic first aid cannot be overstated. Your dedication to learning these life-saving skills speaks volumes about your character and your willingness to make a difference in the world. Remember, the knowledge you carry can turn you into someone's hero in their moment of need. Thank you for taking this important step with us. Stay prepared, stay compassionate, and remember, together we can be the difference between a life lost and a life saved.